Hello everyone. Welcome to the Joint Institute's Preoperative Education Seminar. My name is Phil Colombrita. I'm the Orthopedic Service Line Manager and Joint Care Coordinator here at St. Barnabas Medical Center. Just a little bit about myself. I've been with the organization for 11 years. I spent 8 years at Robert Wood Johnson University Hospital in Rahway and close to 3 years here at St. Barnabas Medical Center in the same capacity. I have a degree in exercise physiology, and I spent 7 years with JFK Medical Center as their Director of Post-Rehabilitation and Community Wellness, and it was a wonderful experience for me, which led to this endeavor. Today, I'm going to talk to you a little bit about how to prepare for surgery, what to expect after surgery, recognizing and preventing complications, and staying active after surgery. So welcome to the Joint Institute. We have specialized staff, we have patient-centered care, and we're committed to patient and family education. Patient satisfaction and positive outcomes are our number one priority here at St. Barnabas Medical Center. The first thing I'm going to ask you to do is enlist a coach. Well, what is a coach? Find someone to be your coach, because a family member or close friend or someone who can assist you at home is very vital to your recovery. We certainly don't want to send you home right away being alone. We want to make sure that you have a clear plan for discharge. And having a coach, a family member, friend, or someone that can watch over you for a few days is going to be vital to your recovery. In our post-COVID world, our coaches cannot attend our rehabilitation sessions here in the hospital, but you are going to be vital in the recovery of your loved one. A little bit about pre-admission testing. Pre-admission testing has taken on a little bit new role here at St. Barnabas Medical Center post-COVID. So to make sure you are optimized for surgery, you will need lab tests, EKG, blood work, obtain cardiac clearance if necessary. This is very, very important. If you think you need cardiac clearance, your cardiologist should clear you well before your surgery. Testing for COVID-19 will begin on a specific date and time prior to your surgery. That will be communicated to you by our pre-admission testing department when they call you for this. A nurse practitioner will be calling you prior to your test for a remote interview if additional optimization is necessary. One thing that's very, very important is to report any infections or cuts. Tell your surgeon if you had any cuts or infections. Refrain from shaving 48 hours prior to the surgery. Why is this important? Well, if there are any open sores or cuts, we do not want a portal to infection in the operating room. Thus, no shaving from 48 hours prior to the surgery. You will also receive multimodal medication when you come for your COVID test / pre-admission testing on that day. A multimodal pain management program is used by many hospitals across the nation, and it involves taking medications prior to surgery that target different types of pain. This medication can be picked up when you come for your COVID or PAT test. Masks must be worn when arriving at the hospital at all times. The goal of this multimodal pain management regimen is to control pain early to reduce recovery pain subsequent to the surgery. The regimen is tailored to each individual patient and may not be right for everybody. So what does this involve? Well, the multimodal pain management regimen includes taking 3 different types of medication that will target 3 different types of discomfort prior to the surgery. The reason we give this medication prior to the surgery is so it creates a buffer in your system, so when you open your eyes in recovery, you have a head start on pain control. The night before surgery, you would take 1 capsule of Lyrica, which is 50 milligrams, and 2 tablets of Tylenol, which are 500 milligrams each. On the morning of surgery, you would again repeat your 1 capsule of Lyrica at 50 milligrams, your 2 tablets of Tylenol, 500 milligrams each, and 1 capsule of Celebrex, 200 milligrams. Again, the 3 different types of pain you'll encounter would be nerve pain. Lyrica is there to help alleviate the nerve pain associated with your incision. Your skin has nerve endings, and this will definitely be a help. The Tylenol, we all know what that's for. It's for bone pain. And the Celebrex is there as an anti-inflammatory component. Any questions with regards to your medication or whether you can or cannot take this medication, obviously your physician would have to weigh in on. Okay? Any further questions with regards to how to implement this medication in a different way, your nurse practitioner or our pharmacist can answer any questions when you pick up the medication. Another prescription that you will receive, if deemed necessary by your prescriber, is a transderm scope or scopolamine patch. This is a 1.5 milligram patch, and it's applied externally behind the ear on the morning of surgery. And they typically will remove the patch 24 hours after surgery. This will help quell any nausea that would be related to your anesthesia. Some of the side effects include drowsiness, blurred vision, difficulty urinating, and dry mouth. So not everyone will be a candidate for this. The Barnabas Health Retail Pharmacy is located on the east wing of our hospital. When you come in for your pre-admission test, your COVID test, and after you leave, you will be directed to our pharmacy on the east wing, and directions will be provided for you. Our pharmacy is a community pharmacy. It is a convenient one-stop shop for prescription and over-the-counter needs. They accept all major health insurance plans. They have bedside medication delivery for when you're in the hospital. And for personal questions about medications, you can speak to our pharmacist, as I said before. Other medication instructions: it's generally acceptable to continue taking these medications unless otherwise directed. Blood pressure, heart, thyroid, diabetes, and cholesterol medications are all acceptable, but please, if you have questions, please refer to your clearing physician. Vitamins. Many of you take vitamins for oral supplementation. Vitamins are generally acceptable to continue to take. However, we want to eliminate herbs. Because herbs are not FDA regulated, we don't know how they will interact with the medications that you're taking. Your nurse practitioner will go over any and all herbs that you may be taking that you need to stop. Some examples are fish oil, St. John's wort, garlic. Those are oral supplements that are considered herbs that you need to discontinue before your surgery. Check with your physician regarding when to stop blood thinning medication. There are many different brands of blood thinners on the market today that will require different stoppage times prior to your surgery. So please check with your physician as to when to stop these medications. It's usually okay to continue to take Tylenol or Celebrex to control discomfort. If you cannot take the Lyrica and you cannot take the Celebrex, please consult with your physician for different options. There is no replacement for those medications if you cannot take them for medical reasons. What to bring to the hospital: loose-fitting clothes, sweats, shorts. Listen, when you come here, your stay is going to be just like going to the fitness center. So for you total knee patients, shorts are a must for obvious reasons. Access to the incision is very, very important, so wearing shorts is a good thing. For you ladies, you may wear a sundress or any type of dress that slips on over the head, neck, or shoulders. That is totally fine. For hip patients, sweatpants or shorts are acceptable. The incision line would be in the same spot. From a footwear perspective, a walking shoe with plastic laces, Velcro, or regular laces are a must. Please avoid slip-on shoes. They would not be safe when ambulating. Dental appliances or dentures, glasses, contact lenses and their cases, hearing aids, they are all acceptable. However, you are not going to be eating anything the night before surgery, so please, your dentures, pack with you. Do not wear them to the hospital. If you can, please remove your contact lenses 24 hours prior to your surgery to avoid irritation. Please wear your glasses to the hospital, and you may pack your contact lenses. Hearing aids, you're going to need to hear what everybody's saying to you, so up until the last moment before surgery, please keep them in, but please hand them to a loved one or put them aside and packed away before you go in for surgery. Personal toiletries are fine to bring. Your cell phone, your charger, your laptop. We have free Wi-Fi in the rooms for you during your downtime. You may log on and use your laptop or portable computer. If you use a CPAP machine, they are usually very portable these days, so please feel free to bring your CPAP machine if it allows you to sleep a lot better. Leave your valuables, your jewelry, and large amounts of cash at home. You won't need them. And you may bring a copy of your living will or advance directive if you have one. This is not necessary. You don't need to go out and do this if you don't have it, but if you feel more comfortable bringing it with you, it will be copied upon admission and put in your chart. Please bring a list of all your medications you're taking, including the frequency and last dose taken. Even if you are on no medications at all, you're coming into the hospital taking the Lyrica, Celebrex, and Tylenol, that you are now on medication. So please bring that updated list. You may be wondering why you have to do this again if you've come for pre-admission testing and provided a list. Redundancy in healthcare is a good thing. So bringing an updated list when you register for surgery ensures accuracy. For you hips, you're going to bring your adaptive equipment, and I will explain what this is in a second. Posterior lateral hip approach will require hip precautions. So there is no hip flexion over 90 degrees. Sitting, your knee should be lower or at your hip level. No bending forward at the waist while sitting. No flexing your operative leg up while sitting. No inward rotation of the hip or turning your leg in or what would be considered pigeon-toed. No crossing of your legs or crossing midline. Our occupational therapists will review these precautions with you. Our physical therapists will also verbally cue you, and so you can recite these precautions and visibly demonstrate these precautions while you're in the hospital. When you leave the hospital, your adaptive equipment, and I promised you I would get to it, your adaptive equipment comes into play. So as you can see from the screen from left to right, the long-handled reacher is for if you need to reach objects that are at a higher level, or if you're walking on your walker with your walker and you drop something. Let's say, guys, you take out your wallet from your back pocket. Whoops, you dropped it. Well, how am I going to pick that up without breaking precautions? Well, you can't without this long-handled reacher, and the reacher will definitely help you with that. The next item is a sock aid. And again, putting on your socks would be challenging, and in breaking precautions, you would definitely do that without assistance. The sock aid allows you to place the sock over the end of this apparatus. It can be placed on the floor, your foot slides in, and those bungees that you see will pick the sock right up, no problem. The shoehorn needs no explanation. The item next to the shoehorn is a sponge on a stick, or a washing stick, which will allow you to wash your lower extremities when you're in the shower without bending over or lifting your leg up, which we definitely don't want to do. The last item that you see is a dressing stick. This is a special stick with a hook at the end to help lift up your pants or underwear or anything that you may need to get from floor to the waist. The occupational therapist, when you bring this kit to the hospital, will work with you in all aspects to ensure that you're comfortable with these pieces of equipment. These pieces of equipment can be purchased at our retail pharmacy when you come in to pick up your medication, or they can be purchased at Amazon.com or Walmart.com. Please note that there is a 20% discount coupon given by our pharmacy here at St. Barnabas Medical Center. The day before surgery, you will receive a call from the same-day surgery center the evening before regarding the time and location of your surgery. The calls begin at 4 p.m. and they last until 8 p.m. or until every last surgical patient is contacted. Please do not panic or worry if the day before your surgery in the middle of the afternoon that you do not receive a call. Those calls begin at 4 p.m. If you do not receive communication, please call the number on the screen, 973-322-5130, Monday through Friday until 9 p.m. I have never had a patient tell me same day did not call them with their time. The day before surgery, from a nutrition perspective, eat an early, healthy, and balanced meal the evening before, unless directed otherwise. You may drink water up to 2 hours prior to your surgery start. Now I'm going to talk about hydration. When you come out of anesthesia, it's okay to be a little hungry. You could expect that. But being dehydrated is not good. So what we found is that hydrating patients up to 2 hours prior to your surgery is very, very important and necessary. You are to drink 12 ounces of water, no more, no less, up to 2 hours prior to your surgery time. And here's a little trick that I kind of talk about with patients with regards to how to consume the water. The morning of surgery, you're going to be real busy. You're going to be collecting things. You need your ride. You're getting in the car. You have a lot of things to prepare for, and we understand that. And you may come to the hospital and say, oh my goodness, I didn't drink my water, and I didn't get hydrated. And then you start to drink your water after you register when you're here, and that could be too close of a time frame to your surgery start. Thus, what would happen is your surgery would be postponed. And we don't want that to happen. So my recommendation, when you take your Lyrica, your Celebrex, and your Tylenol the morning of your surgery, crack open that 12 ounces of water, take your medication with the water, and then on the way to the hospital, mind you, somebody's driving you, you're not driving yourself, Drink the water and finish the water before you get to the hospital. You get out of the car, you have an empty water bottle, and you know that you're hydrated and ready to go for surgery. Avoid smoking the day before and the day of surgery. Seek assistance to try and stop prior to your surgery. This is important. If you smoke the morning of your surgery or the day before, your surgery will be postponed. The last bullet point here is very, very important. Stop the consumption of alcoholic beverages. If you feel this may be a problem, please consult your surgeon. You need to do this right away. Everyone has a different definition of social drinking. So again, if you feel that this may be an issue, please consult your surgeon. I can't stress this enough. What can happen if you don't discontinue alcoholic beverages is after surgery, you can experience delirium, you can experience hallucinations, you can experience other types of withdrawal symptoms. So we want to make sure that doesn't happen. Any questions with regards to how much you drink or if this is going to be an issue, please contact your surgeon. Moving on to skin prep. It's very, very important and mandatory that your skin be prepped to safeguard against surgical site infections. So what we use here at St. Barnabas Medical Center is chlorhexidine gluconate body rinse, which is like a body wash to prep your skin for surgery. This prep rinse will be used 2 nights before your surgery, the night before your surgery, and if you choose to shower the morning of your surgery. It's very, very important. The bottle of rinse will be provided for you in pre-admission testing / your COVID test day. What to expect in the hospital after surgery. So now I've gotten you to the point where you're opening your eyes in the recovery room and your hip has been replaced, your knee has been replaced. What's the first question patients are going to ask? Pain, right? How much is it going to hurt and what are you going to do about it? Well, as you can see here, we have a replication of what would be on your whiteboard in your room. You will have pain. So we want to make sure that you understand what that discomfort is. Your pain is going to be very, very different, or I shall say discomfort will be very different than the arthritic pain that you had before. When you think about what you're going through right now with your hip and your knee, which is what brought you to having surgery in the first place, it's going to pale in comparison after the surgery. Think about muscular discomfort. Think about how that feels. Think about going to the gym and doing 100 squats when you haven't done that in a long, long time. Think about how sore your glutes will be and your legs will be. Well, that's pretty much what you're going to feel after your surgery. You're going to start from square one on learning how to ambulate with your new joint. So most of you that were walking with a limp before, you can expect that to improve over time. So when you look at the whiteboard here and what you'll see in your room, you see many different faces, from an extremely happy face to an extremely sad face. So that represents our numeric pain scores. 0 being obviously the best case scenario and 10 being the worst case scenario. So we certainly don't want you to be a 10 pain. So that's why we're there to address your pain control very timely. Your nurses, when they introduce the night shift and day shift, one of the things that they do a really great job at is having a patient be involved in their care and definitely going through what your pain may be in order to address it. There's many different ways pain can be controlled. And I went back, way back when I started to talk about the Lyrica, the Celebrex, and the Tylenol to take before your surgery. Well, after your surgery, you're going to be given the Lyrica, Celebrex, and Tylenol around the clock as necessary and as needed. Your nurses are going to be there to help control your discomfort. And I want to get into a little bit about what you're going to experience when physical therapy comes in to see you. So they're going to ask you, what is your pain? And I'm going to let you know right now that when you look at the board, the number between 4 and 6 is that moderate pain. That's where we expect you to be functional for physical therapy. So again, going back to the board here, you will have discomfort, you will have some pain, but again, you're here to move, you're here to get physical therapy. That's the reason why you've had the joint replaced in the first place, so you can be pain-free. And it's going to take some work to get there. So the expectation is if you're between a 4 and a 6, that's considered moderate discomfort or moderate pain. Your physical therapist and your team will expect you to perform between a 4 and a 6. Well, obviously, if your pain is between 8 and 10, we certainly don't want that. So that's why that next line, do not be a hero, is very important. We certainly don't want you refusing medication if you need it. Communication in this respect is very, very, very important. As important as it is for our nursing team and our clinical team to communicate to you, it's just as important for you to communicate to our clinical team with regards to the type of discomfort you are in so they can manage it appropriately and you can be ready for physical therapy. Other pain management interventions. So there's a couple of different ways, non-opioid, that we ensure patients are comfortable in the rehab process. Number one is a nerve block. And our nerve block will be issued in different ways to our knee and hip patients. So as you see here, a catheter may be inserted into the quad to provide continuous numbness for up to 3 days. Well, your discharge day is going to be much sooner than that. However, that catheter is attached to an on-cue ball with a medication called ropivacaine. You'll carry that around in a fanny pack, and it is not sutured into your quad, and this will provide continuous medication to help with the incisional discomfort. So when you flex and extend your knee, this medication is really there to help with that tightness or that stiffness that you may be feeling after the surgery. For hips, you will get a single shot tap block in the recovery room. Many of you might not even know you've gotten it, but that should last anywhere between 24 and 48 hours so you can be functional for physical therapy. After surgery, you'll have an incentive spirometer in your room. This helps clear your lungs, and it helps you feel better. And you may rest after surgery, and you may eat or drink when you feel ready. You're going to be asked to sit up in your chair pretty quickly, and physical therapy will get you to walk within hours after your surgery. So depending upon your surgery time, you will be walking pretty soon right after surgery to make sure that you're good to go. Your next couple of days, your postoperative day 1 and 2, your blood work and vital signs will begin early in the morning. You'll be out of bed and in your recliner chair before 7 a.m. Your functional therapy sessions are there to ensure a safe return to home. So our therapists are going to work with you on stairs, car transfers, and ambulation. For knee patients, they're going to add ranging the knee or bending and extending the knee to ensure you have adequate flexion and extension. For some of you knee patients, you may not even come up to our floor on 4 West. You may go right to our new enhanced patient unit, which is in our same day area. So there, patients will receive physical therapy on day 0, meaning your surgery day, and early postoperative day 1 prior to discharge, and then you will be sent home with home care or outpatient physical therapy to follow. The EPU unit has drawn rave reviews from our knee patients. It is an accelerated unit, and your physician will make the decision if you are safe to go there. Your meals in the hospital. A representative from dietary will be reaching out to you asking to order all your meals ahead of time. If you are discharged earlier than anticipated, your order will automatically cancel out. Discharge planning. Our goal is to discharge to home the very next day. So postoperative day 1. Day 0 is your surgery day. Day 1 is the goal for you to go home. Have someone available to drive you home from the hospital. Patients leaving 4 West on day 2 can expect to be discharged between 11 a.m. and noon. Patients leaving 4 West on day 1 can expect to be discharged late afternoon, early evening. Patients leaving from our EPU unit should expect a mid-morning discharge the day after surgery. Again, have someone who can help you at home for a few days. Your equipment needs, your walker, your commodes, your crutches, anything that physical therapy deemed necessary for you to leave the hospital with will be addressed by our case management team and our therapists. Please schedule a post-surgical follow-up visit with your surgeon 2 weeks from your post-operative date. Please do not schedule this any earlier. The surgeons have asked me to relay this to you, that 2 weeks is the minimum time for your post-surgical follow-up. Please also schedule a post-surgical follow-up with your primary care physician, and you may use the week that you're scheduling with your surgeon as your guideline. We want to make sure that your surgeon is looking at the incision, the healing of your incision in your hip and knee, but your primary care physician is going to look at your overall health after. We certainly want to minimize or limit readmissions back to the hospital for other health reasons, so having that primary care physician appointment is very, very important to minimize that. For patients who will be going directly to outpatient physical therapy, St. Barnabas has 2 locations: our ambulatory care center, 200 South Orange Avenue in Livingston, or 120 Milburn Avenue in Milburn. Our case management team will provide you with this information upon discharge. For those patients who qualify, our joint replacement home recovery program is a nice bridge between going home and outpatient physical therapy. This program allows you to regain your strength and independence while in the comfort of your own home, under the supervision of your physician. A member of our home care team will be contacting you in the hospital with regards to this service. Home care services include physical therapy, occupational therapy, and visiting nurse. And this is all based on your insurance benefits. Our representative will check with your insurance prior to scheduling this. I'm going to go over recognizing and preventing complications. It's very, very important that patients understand the risks. Some potential complications: blood clots, infection, pneumonia, or hip dislocation. Blood clot. What is a blood clot? Signs and symptoms: swelling in the calf, thigh, or ankle that does not go down with ice or elevation, pain or tenderness in the calf, and it can be in either leg. How do we prevent that? Well, obviously, each physician is going to give you a blood thinning medication to be given at an appropriate time after surgery. Early ambulation is very, very important. The more you move, the more you reduce the risk of blood clots. You're going to be given exercises to do and ankle pumps. It's like waving hello and goodbye with your feet. And this is definitely something that helps prevent blood clots. We also have a Flowtron machine. For those of you not familiar, this machine is located at the foot of your bed, and it's attached to 2 clear hoses. And you will have a Velcro boot or a Velcro calf wrap, and it could be either one or both the same. And this will inflate and deflate to help facilitate the flow of blood when you're sitting down or when you're sleeping. This is very important for you to have on throughout the duration of your stay in the hospital. A PE, or pulmonary embolism, is sudden chest pain, difficulty or rapid breathing, shortness of breath, sweating, and confusion. If you're home and you experience this, please call 911. Infections, signs and symptoms: red incision, increasingly painful joint, increasingly swollen joint, drainage of the incision, temperature elevation greater than 101 degrees. You want to make sure that you follow the plan of care for your incision. Please do not stick your hands in a jar of petroleum jelly or moisturizer or vitamin E and rub it on your incision. There is a plan of care for your incision that your surgeons will provide and your nurses will provide. Keep your incision clean. Showering will be determined upon how you're healing. The surgeon and the surgeon staff will make sure you know when you can shower. Keep pets away from your incision. When you walk in the door, your pups, big or small, miss you, they love you, and they're there to greet you. We want to make sure that you don't fall or trip or they knock you over. But most importantly, animal saliva is not clean. If your dog or cat licks your incision, an infection may occur, so please be careful. Pneumonia, signs and symptoms: cough, fever, shortness of breath, painful breathing. So please, deep breathing exercises, use your incentive spirometer, keep moving. Very, very important. Dislocation of a hip. The hip is a risk to total hip replacement patients. Follow your hip precautions as outlined by your physical therapy team, and it can be very painful. If this happens, please call 911. Discomfort. Stay ahead of your discomfort. Take your medications as needed and as prescribed. Please use your ice. We will be sending you home with an ice pack, and the directions for use will be included with it. Continue to move to reduce swelling. With your medications, please do not self-diagnose. If you have questions or want to stop taking a specific medication, please check with your doctor before doing so. Do not take it upon yourself. Enjoy your new joint. Don't sleep too much during the day. Keep up with your rehab schedule. Get out and get back to normal. Go for walks after surgery. You will hear from us 2 weeks post-discharge. Our nurse manager on 4 West or our EPU unit will reach out to you with a brief survey. We want to make sure that we're enhancing our services and your stay with us, so your feedback is very, very important. Please call me with any questions. My office line rings directly to my cell phone. You see my number, 973-322-9546. You can reach me anytime, anywhere. Please leave a message. I always return calls. The next slide is our physical therapy and getting you moving. Your first therapy session will begin with the physical therapist on day 0. This will begin either the day of your surgery or the next morning based on your time. Your first session includes an interview with the physical therapist, discussion about your discharge plan, reviewing precautions including hip precautions, an exam, and walking. Your functional therapy session will be such. You will walk to and from our gym or our class, reviewing of precautions. You will do specific exercises related to the knee or hip. You'll be doing stairs and car transfers. And coaches will be encouraged to attend. Discharge planning. It starts immediately. In the pre-op class that I've talked about this earlier in the class, and it will depend upon your functional status, your progress in therapy, how much assistance you have at home, your home environment. Your therapist will discuss recommendations with you after their initial evaluation. We want you to walk. It's very, very important. I've said this on several occasions now, as you probably are wondering why I keep saying that. Walking is very, very important. It's the single thing you can do to ensure the prevention of blood clots and that the joint heals properly. When you're in the hospital, please ask for help if you need it or are unsteady. Your physical therapist will let you know if you're steady to walk independently or with family while letting your nurse know. However, please, if you need to use the bathroom, even though you've been deemed independent, please hit the call button. The single greatest thing we can do in the hospital is prevent injury, and falls are number 1. So please let your nursing staff, your nurse assistants know if you're on the verge of getting up. Exercise before surgery. This is really very, very important. When you're looking at this, I'm going to present to you some very basic and simple exercises. So please, increase or maintain your strength. Increase or maintain your flexibility. Familiarize yourself with the exercises you will do after surgery, and exercises are strongly encouraged before surgery. Both hip and knee exercises are recommended for all patients on both legs, sort of a prehab. Exercise before joint replacement surgery has been shown to improve postoperative strength and function, as well as reducing the need for inpatient rehabilitation. As you can see, these are exercises that will be replicated here in the hospital, and they are very self-explanatory and very benign. They are designed with patients who are in pain in mind. So if you think you're in too much pain, think again. You can help strengthen yourself with these very simple functional exercises. As you can see, the ankle pumps, waving hello and goodbye with your feet. Your quad sets are there to strengthen your thigh, and you can see by the illustration that this person has a towel roll underneath their ankle. So when you're in a lying down position, place the towel roll under your ankle, and what you want to do is press your knee to the mat or to the bed and tightening your quad. This is very, very, very helpful. Your glute sets. As you can see, with bent knee, lying on your bed or a mat, please do not get on the floor. I don't recommend that. Squeeze your butt together. This will help your gluteus maximus and gluteus medius strengthen prior to surgery. And why is that? Well, when we get up from a chair, we are replicating a squat, and in a replication of a squat, our glutes are engaged in that process. So this will help with that. The next illustration you see is a heel slide, and this will help both knee and hip patients gain flexibility in their quad and in their hip flexor area. The hip abduction slide shows a patient in the standing position holding onto a solid surface. Please do not do this without holding onto a solid surface. It's very important. And you just kick your leg out to the side and bring it back to midline. The clear illustration on the right shows the patient in a lying down position. Short arc quads. The short arc quad, much like the quad set, will require a towel roll to be placed under the crease of the leg when you're in a lying down position. And all you have to do is lift your foot off the bed. It's a very short motion, and it's there to strengthen the muscle right above the knee. Your long arc quad is a long arc leg extension you can do from a chair or seated position, and it just requires you bringing your foot from the floor to extension. Finally, the armchair push-up. The armchair push-up is important because we want to develop upper body strength. You're going to be pushing yourself out of a chair. So doing the armchair push-ups will strengthen the tricep muscles and the shoulders alike. So this is important. 2 sets of 10 is adequate enough, and it should take you no more than 10 to 12 minutes to do all these exercises. And you may do these twice a day. This is body weight resistance, so there is no limit on how much you can do. Thank you, and we look forward to working with you. Again, if you have any questions, please call me at 973-322-9546.